I'm really sorry to disturb you. I know you've been getting some good sleep, but I'm just the night nurse here, and I'm going to be doing a head-to-toe exam, okay? Alright, do you remember why you're here? Okay. Yes, the follicles in your ankles. Okay, how are they feeling now? Good. Okay. Do you remember the day? Yes. Great. And just to confirm, your first and last name and date of birth. Okay. Okay. Pain medication seems to be working. No more nausea. Okay. And have they brought you anything besides water yet? Good, good. Okay, we're going to be just monitoring you in the next 4 or 5 hours before we reintroduce solid foods, okay? So it was quite the surgery you had, but everything went really well. And we're just waiting on the go-ahead from the surgeon. Okay. All right. Do you have any questions for me? Great. I'm going to pop on some gloves and just begin the exam. Are you comfortable right now? Okay. And on a scale of 1 to 10, how would you rate your pain? Oh, that's really good. All right. All right. Okay. I'm going to start by listening to your heart and your lungs. And just breathe normally for now. Okay. Okay, very good. I'm going to flip over, listen on the bell side, just to hear for any murmurs, listening for that. Beautiful. Any heart palpitations? Okay, good. Any history of heart murmur? No. Okay, great. I'm gonna listen to your lungs now, okay? So I'm going on the side. Go ahead and just take one deep breath in for me, if you can. In, 2, 3, and relax. 2, 3. All right, one more. In, 2, 3, and out. 2, 3. Perfect. I'm gonna listen on the other side. Okay. In, 2, 3, and out. 2, 3. Okay, one more. Great, your lungs sound in good shape. I'm just gonna go ahead and write that down. Okay. I'm going to take your temperature next, so just hold still for me. Okay. Beautiful. You're at 97 degrees. It's gone down a little bit since you were admitted, so that's a really good sign. Okay, and while we're at it, I'm gonna go ahead and grab your oxygenation. So if I could look at your index finger right here. Perfect. Okay. And your legs are uncrossed. Yes, okay. Okay. Okay, you're 99 at room air. Your heartbeat is 63 beats per minute. It's a little bit low. So I'm gonna go ahead and take your blood pressure. Okay. So I'm just going to slide this up your arm very gently. It's going to go right here a little. It looks like that is resting perfectly. Good. Okay. Just bear with me here. A lot of moving parts. Okay, just hold still. Sorry, is that too tight? Okay. Okay. Excellent. You are at 112/72. That's really good. Okay. Okay, I'm very encouraged by that. Just get this out of your way. Okay. Looks very good. Just gonna look right at the top of your forehead here. Little dry patch here at the top. But nothing I'm too concerned with here. Okay. I'm gonna go ahead and palpate the face. Do you mind if I touch you? Okay, just very gently feeling. Just feeling for any lumps or bumps. Okay. So I'm going to be pressing both sides of your cheeks. Let me know if you feel any pain, okay? Any pain? Okay, just pressing gently on your chin. Pain there? Okay, and just very gently on your nose. Pain there? Okay. I'm not feeling any swelling, edema. Just going to make sure there's no heat on the skin. Feels normal to me, okay? Any itchiness? Okay, I'm going to do some percussions. Also, before I do that, I'm just going to feel the top of your head just to make sure there's no abnormal fissures or bumps or anything. And also right on the back of your neck and your cervical spine, okay? Just the very base of your spine. I'm just feeling right here. Okay, so that feels normal. No abnormal curvatures. No signs of scoliosis or lordosis. Good. Just feeling the spine. Just the first few discs. They're normal. Okay. Good. I'm going to feel the top of the head now. Okay. Okay. Looks normal. I'm just going to take my pen and look here. The scalp line looks normal. I'm going to grab my lice comb just to see if there's any little critters that I need to be worried about, okay? Okay. Okay. Do you see anything here? Oh, you have to look at the comb. You see anything? No. Okay. So I'm going to go ahead and say you're clear in that regard. Scalp is healthy. And no signs of bumps or lumps on the skin. Okay. Coming closer again, I'm going to do some percussions, okay? Just try to hold still. Good. And close your eyes. Just getting the sides of the face. On the top of the head. Okay. And any pain there when I press? Okay. I'm feeling normal reflexes. some facial myotomes just to judge the strength of your facial features, okay? Okay, don't worry, I'll explain it to you. So I'm going to place my finger gently on the bridge of your nose. I want you to turn just with your head, not with your whole body, just with your head, to your left, okay? And just fight against my push. In 3, 2, 1. Good, okay? Let's do the other side. 3, 2, 1. Very good, okay? Strong reaction. Try to look up at the ceiling for me. 3, 2, 1. Okay, very good. Now try to touch your chin to your chest in 3, 2, 1. Good. Lift up your eyebrows for me. Lower them like you're angry. Okay, widen your eyeballs like a big husky. Okay, good. Now squint them into a little ball. Okay, smile for me. Show me all your teeth. Good. Frown. Excellent. Okay. Okay, next I'm going to be checking for any nerve damage or nerve abnormalities. This is a sharp or dull test. Okay, so this is a dull sensation. Do you kind of feel that as a tickle? Okay, and this is sharp. So go ahead and say sharp or dull. Close your eyes. No peeking, okay? Okay. Good. Good. Yes. Yes. Okay, no falling asleep, okay? I still need you to answer these questions. You can sleep as soon as I leave, okay? Alright, just bear with me here. Sharp or dull. Try to stay awake. Good. Excellent. Good. Good. Oh, that's great. Okay. Now, just using this point, I'm going to be poking the left or the right side of your face. Say left or right, and close your eyes. Good. Excellent. Yes. Good. Okay. And any loss of sensation of the face? Any numbness, tickling sensations? Okay, that's good. It's good that we did the test anyway. Okay. So far, everything's looking really good. Just gonna take a quick look inside your mouth. Okay, open wide for me. Okay, lift your tongue. Good, lower it. Good, now put it from side to side. Okay, good. Not seeing any signs of mouth infection, gum disease, plaque gingivitis. Of course, follow up with your dentist if you're feeling any pain, but I just want to do an initial inspection to see if I can see any sores. I don't see any sores, so I think you're good. Okay. So, go ahead and just follow this light with your eyeballs for me. Follow it. Okay, don't move your head, just your eyes. Good. Yes. Okay, now ignore this light. Just follow my fingers here, okay? Just follow the fingers, ignore the light. Focus. Alright, great. Now let's focus on the light again. Let me know when the light leaves your field of vision. Say now. Good. Yes. Beautiful. Yes. Amazing. Which fingers of mine are closer to you? The ones on your left or your right? How about now? Okay. Which fingers are moving? Good. Good. Excellent. So your field of vision tests are good. Now, I think I'll look inside your eye. Okay. Okay, coming close. Go ahead and open your eye. Look straight ahead for me. Looking very closely here. Good. Pupil is very reactive to light, constricting appropriately. Round. No signs of jaundice or infection. No signs of damage to the optic nerve. Go ahead and blink for me. Okay, now stare straight ahead. Now look to your left. Look to your right. Now roll your eyes. Good. Alright, looks great. Look at the other one. Same thing here. Okay. Very healthy. No dryness. No excess tear duct production. Look up. Look down. To your left. To your right. Roll your eyes. Hi. Do you remember what happened? Okay, good morning. You fell asleep during your eye exam last night. That was the one thing I told you not to do. Okay. But I think you really needed it, so I decided to end the exam there and let you sleep. Thankfully, I think we gathered enough information. You seem okay now, just very, very sleepy. We're going to continue with an ear exam. So just letting you know that it is a day later right now. Okay, not to worry, you just got very, very sleepy. I'm going to be looking inside your ears. Okay. You don't feel faint at all? Just a little groggy? Okay. All right. Not a problem. Okay. So I'm going to go ahead and turn your head from you. I'm going to be looking right inside the ear canal. Okay. Tympanic membrane looks very good. No signs of wax buildup. Okay, I'm really liking what I'm seeing here. Okay. I'm really able to visualize the membrane. Go ahead and turn your head this way. Perfect. Coming a little bit closer. I'm going to look at the other ear. Okay. Same here, not much wax, no need to clean. And no signs of swelling of the membrane, no signs of infection or scarring. How would you say your hearing is? Pretty good? Okay. Let me go ahead and check that. First, I want you to stay awake and repeat the words that I whisper, okay? Close your eyes and repeat exactly what you hear. Birthday cake. Chocolate chip. Batteries. SD card. Light bulbs. Black Panther. Polar bear. Perfect. I'm going to be using a tuning fork next, just running a few simple tests to see if you can tell vibration and volume, okay? Okay. Continue to relax. Let me know when the sensation stops for you. I'm just going to be placing it gently right here on your chest. Say now when it stops. Good. Good. Excellent. We're going to do one more, and this time I'm going to be placing it on your forehead, okay? So say now, close your eyes. Good. Yes. Excellent. Okay. And lastly, we'll be doing a volume test. Let me know which sound is louder, A or B, okay? This is A. This is B. Good. This is A. This is B. Excellent. A and B. About the same. Very good. I think your hearing is pretty good. So, next we'll move on to smell. I have a few smelling aromas for you. Close your eyes. Close your eyes. No peeking. No cheating. Go ahead and inhale this scent for me. What does it smell like? Good. Yes, that is lemon. Okay. Okay. Inhale. What does that smell like? Yes. Okay. Inhale. Lavender. Okay, hopefully that won't make you sleep again. Okay. Lastly, what does this smell like to you? Yes, chamomile. Okay, so your sense of smell is intact. Okay, next we'll be doing taste. So I have a couple strips for you to taste. Go ahead and open your mouth, close it around the strip. Taste it. Good. What does that taste like to you? Okay, that is not supposed to taste like cotton candy. It's supposed to be control paper. It's supposed to taste like nothing. So perhaps you have overactive glands. Something to just keep in mind. I'm going to have you taste one more. This should be very, very straightforward. Open, close, open. What does that taste like? No, not at all. So you said Bavarian pretzel and it was cinnamon. Your taste buds are definitely off. This is a significant cranial nerve dysfunction. I'm going to go ahead and write that down, okay? So we have that. In addition to narcolepsy, you are having a taste dysfunction. Okay, I'm wondering how this affects your day-to-day life. What kind of foods do you eat for breakfast in the morning? Okay. All right, that's interesting. And how does that taste to you? The fried sardines? Very sweet, okay. All right, I'm going to go ahead and just forward this information to our resident neurologist who's going to come and visit. I'm not sure if it has to do with your surgery, but it's good that we got it, okay? Are you still relaxing? Okay, good. Okay. Okay. So next what I'm going to do is just measure some points of it on your face and your chest area just to make sure that no side is swollen, okay? So continue to relax and try to stay still for me because I am gauging symmetry. Okay. Okay. And that point on the nose. Okay. Okay. Just a tiny bit lower. Okay. Just try to hold still. You're doing really good. Okay. Okay, and just the neck here. I'm just gonna feel your thyroid. Okay, hold still. Okay. Yep, that's normal in size. Any pain or tenderness here when I touch? Go ahead and swallow for me. That's good. Okay, just gonna do some measurements here. Excellent. Okay, just gonna go a little bit lower here. Okay. Excellent. I'm just gonna look at your chest here. You're sitting up a little bit for me, which is helpful. That's 9.5. It's 9.5. Any chest pains that you're having? Okay, yeah. I'm just going to just touch with my hands. Okay. Okay. So next I want you to slide down. I'm going to be doing an abdominal exam. With your permission, I'm going to lift the blanket, and with our animal's permission, I'm going to be palpating your stomach, okay? Okay. You're still comfortable? Good. So I'm just going to lift this blanket here. Okay. And let me know if you feel any pain, okay? Okay. Not feeling any hardness or abnormal lumps, so that's really good. I'm going to go a little bit lower. I feel your lymph nodes here. Okay, no issues here. Beautiful. I'm just going to feel any pain right here. Okay, I'm just going to go a little bit harder, just pressing down, okay? You're doing really good. Just stay completely still. Okay. Okay, and no pain. So, I'm going to listen now. I'm going to okay. Just going to be listening to your abdomen. Okay. Okay, no issues here. Very pleased with that. Okay, I'm going to be palpating below the waist, so below the dog. I'm just going to be feeling your legs, okay? Let me know if you feel pain here. Just making sure there's no swelling. Okay, is that painful at all? Okay, I'm going to go on this other side. Okay. I know your feet are really tender right now since that was the main side of the operation, so I'm just going to stay away from that. But I will be inspecting the area just to check for infection. Okay, I'm just going to grab this right here. Just do some very rough measurements. Okay, that's 10.5 left side is slightly larger. I do have to make note of that. It's very typical in this recovery phase. Okay. I'm going to be looking at your feet next. Okay, the wound seems to be healing well. I'm not seeing any signs of pussing. Definitely some redness. It's still angry in the area. We're going to change your bandages here in a moment. But for now, you're looking really good. So I'm glad you were able to wake up and we were able to finish your exam. Do you have any questions for me? Okay. Yes, we will be bringing in that in about 40 minutes. And then we'll have your bandage change at about noon. Okay. So for now, I want you to continue to relax. I know that for some reason my presence has been making you sleep. I do think it's important that you go back to sleep, okay? So go ahead and close your eyes. Rest your eyes. Go to sleep. Alright? And I'm going to be back very, very shortly to go ahead and do that. Okay. So good night. Have a beautiful, beautiful rest. And we'll be back shortly. Your vitals are great and your healing is going fantastic.